about the iliopsoas first because I think this is such a, we get a ton of referrals. Again, make sure it is an iliopsoas. One of the most common mistakes that I see with treating the iliopsoas is one, not finding it, and not treating the origin. So think back to your anatomy days. Where does the iliopsoas originate from? Lumbar, right? So L2 through L7. And we want to address definitely the lumbar component as well as the insertion. And then sometimes with these dogs, we'll definitely have, we're going to look at hip extension. Are we limited? Do we have any issues there? But also look at the rectus femoris, because this is often very restricted. And while I'm in there treating, I'm going to treat the rectus femoris as well, because that often becomes restricted when the dogs are holding their hip in hip flexion. So we've got that tight iliopsoas and the tight rectus femoris. Sometimes that's sartorius also. Think about this also with your post-op cruciates or your conservative cruciates, because they're not extending all the way, and we want to address that also. One of the more common, why is the dog not putting its weight down, and why are they not moving all the way? I find that sight hounds are definitely more sensitive. I mean, again, there's not a lot of subcutaneous tissue there. Even like I'll just take a look and skin roll and see if there's any restrictions. Linda was saying, so it's his left iliopsoas, but we also have to look at the other side because the pelvis is like a bowl. So if you had a bowl full of water and you tilted it, both sides are going to be off. So we always have to look at both sides. And commonly, it's not a big deal. Owners may say, oh gosh, what's wrong with the other side? The other side's fine, we're just compensating. So for when I start with the iliopsoas and coming up and under, and again, you're going to locate that area. Coming up, when in doubt, you can keep your finger on it, flex the hip, it should soften, like almost like a hot knife in butter. And when you extend, it should tighten. Common mistakes, if you're shock waving, like, their groin area or an intact male's parts, some of the police dogs that come in, you don't know where you are. If you hit the testicle, they're not going to be very happy. So I'm going to come in, I'm going to find my spot, and I'm going to hold. And, how long do I hold? Oh, watch, and kind of see if he starts to relax. I'll wait a little bit longer and then start to move around. So my preference is to keep my other hand. This hand is doing nothing but feeling. Is he starting to relax? Is he starting to, just let go a little bit? So it's starting to relax. It's starting to feel, good to him. I do tell owners whenever I'm treating the iliopsoas area or doing soft tissue work, if the dogs have a loose bowel movement, this is why. Don't worry about it. So then I'm up in the iliopsoas, and I can now come down and just start to treat that rectus area. And again, I'm watching him, I'm feeling him. My chest is up against his leg, other leg just offering a little bit of support. And notice that he's up on the table. How many of you treat on the floor? Your backs will kill you. Sometimes like Maverick, we're not moving up onto the table. So sometimes you have to do it, but if you're doing it for every patient, your back, your neck, your legs are going to start to kill you. So definitely, I always say you're the most important part of your clinic there. And for the rectus, I'll come down right into the belly too. Sometimes this can be a little bit sensitive, and if it is, I can just lower it, lower the intensity of the hamstrings to relax a little bit. That helps relax the dog as well. So this is where I like to start, and I'll hold, again, just maybe I may hold for 500 on each side, maybe a little bit more, just depending. If it's the first time, I'm going to go less than more. And then I move to the lateral. When you come near the patella region, just be careful because again, it is fairly thin. There's not a lot of soft tissue there, especially a dog like him, but think about all our little Yorkies, and we're being overrun by French Bulldogs right now, either with disc issues or patella issues. There's a lot. We do a lot with the unit with MPLs and working on those medial structures to see if we can't loosen them up. So we have the dog inside lying on they lie on the affected side. So we'll move around, all that, and then come lateral, and then just finish up. Sometimes I'll spend a little bit more time on the hamstrings again, then that relaxation. A lot of times, even we think like we're relaxing the dog up here, but sometimes while they're standing, just come and knead the distal hamstrings because that relaxes them so nicely. And they start to kind of melt in. So looking at your frequency, this is, what will work best for you. Just in my head, I think older dogs, a little bit more relaxing. I keep my frequencies a little bit low, but that's going to, your treatment plan is going to be, your treatment time is going to be longer. But I'll typically start out around 4 or 5. So, again, this is something you can play with. Deeper muscles, I'll also lower the frequency. I don't know how much scientific proof that's there, but to me, like this is just going in, like it's a little bit softer, a little bit more relaxing. And then your intensity, I'll start with 1 or 2. I don't really go past that, unless it is maybe a larger dog. The other area that you'll commonly see issues if you follow up is L1, L2. This is a hot spot typically with dogs with hip dysplasia because they're not extending all the way. They tend to have that waddle in their gait. So addressing this is important, and it doesn't take long to treat that area at all. This may not be I'm always going to this spot, and maybe just once, because once we restore, again, reduce that pain, inflammation, restore movement, we're okay, and then we start to get some more extension back. But I really want to focus on these paraspinals. So I'm sure everyone has seen them iliopsoas issues that have gone on and on and on, and the dogs start to develop a C curve, because of all the adaptive shortening that's going on. You have changes in, definitely the spine with the lumbar components being side flexed on each other. When I come up to the lumbar component, I'm going to switch heads. So with the unit, we want to make sure we're always turning it off before switching heads. Area I'm going to work with him. So it's not, again, exact science, but what is going to be more comfortable with the dog, what is going to feel better. But think about what the muscles are doing, and we can control that a lot. Sometimes, again, even just working on skin rolling. We had a dog come in Thursday, bilateral cruciates, had one repaired, and the main problem was her back. Her lumbar spine was in so much pain just at the slightest touch. So treating that was definitely one of our key components. So again, ultrasound gel onto the area. Again, I'm going to put the frequency up to 5. This is a little bit of a thicker area, so I may start with 2, but I'll turn it down if he has any pain. This is louder, so if the dog hasn't heard this before, having them understand. If I can, and you could figure it out, he's pretty easy to do, is just try to side flex him the other way while you're treating, because that will start to open up the facet joints as well to get a little bit more penetration, and also the soft tissue. So we're getting them out of the C and going the opposite way. You can do this also if the dog lies down and you can position them to move them into improved C curve, if that makes sense. So you're stretching at the same time. You can also, if you have 2 more sets of hands, while you're hitting the iliopsoas, you can try to stretch at the same time. So a lot of the police dogs, the handlers are able to stretch for me, so we're able to do that and keep them occupied. Does that all make sense? Or conditions I see that's pretty frustrating is bicipital tenosynovitis, right? So a couple things that, you know, just through the year, some of them will get better, some of them not. I have had great success with using Shockwave on the area, but so imperative, owners cannot let the dogs jump down at home. So dogs don't walk around doing this with their biceps, right? It's that eccentric slowing down that continues to aggravate them. So usually, you know, we're doing so well, and then owners will let them go do something and they aggravate it. So what I'll do with, we want to make sure it is definitely biceps issue, right, is treat the area first, and I begin with them in a little bit of flexion. We keep talking about the different heads and what is going to be appropriate. So this is the 10, I think, because I can't see. So
Yes.
you can use this, or I can even get a little bit more pinpointed. So this would probably be a little bit more appropriate for a German Shepherd, for Rex in there. So I'll go a little bit smaller. Keep in mind, a lot of people have said you just set it on one setting for all, and that shouldn't be the case there. So you should definitely adjust it. You know, what you do, put it on. You know, the dog, I tend to gel.
And so what I'm finding is a lot of people will choose different paths throughout their treatments. Because they want to get more gradually deeper, so that's got a center penetration at 5 millimeters, and then you might do 500,000 cells of there, and then you might go try to get deeper into the joint line with a 15 or something like that. Not unusual for people to use different paths throughout the treatment.
Absolutely. And you think, you know, the biceps tendon is very superficial. So, you know, what we're going to start with that, and then we'll talk about getting deeper into the joint. So there's nothing wrong with starting at 0.5. You know, do I feel if this is an acute case and very sore even to my touch, I'm going to start off pretty low. So and see how that goes. I can always move up, I can always move down. Remember the dogs with hair, he's basically naked, so he may not, don't have a lot of that hair in there. So I'm going to constantly, what are some signs of pain or discomfort that the dog may give us?
Breathing.
Breathing, holding their breath, tongue, licking, dilation of their, looking at me like, what are you doing? You know, and you have to make sure, is this the sound of this? Because this is odd. Is anything? So as I flex the elbow and the shoulder, I'm opening up that area a little bit more, so giving me the pathway right in. I'm looking for him to relax. I'm not really doing anything with my left hand except sort of feeling. So talking about body mechanics, I have no problem sitting on the table, straddling the dog. Do what works for you. What is easy. Just safety. Always make sure you get out of the line of potential with anything. But so with the biceps tendon, I'll start. I don't want to do too much too fast because again, we don't want to create any soreness. What we're trying to do is decrease that inflammation, right, and decrease that pain, but then we want to also elongate that area. If we think about the biceps tendon or any inflamed tendon, if fibers should lie in parallel with each other. When there's inflammation, it's almost like someone took a box of toothpicks, threw it on the ground, and they're all in a disarray. And that's essentially what we're dealing with the inflammation. So we want to try to line them. If you can do it tonight, sit down and play with the toothpicks that are on the floor. If you keep going in one direction, you'll realign the fibers. And essentially that's what we want to try to do, and then elongate. So not if it's an acute case, but subacute, we can start doing some stretching. So before I get to the rest of the shoulder, I'm going to try to stretch the biceps tendon and feel, is he reacting? Is there anything else going on there? And then, I know, just touching you.
Yeah, and his attitude towards this is different than that.
So,
I mean, he's just,
like
his
whatever.
eyes were closing
And then, so C5, C6, or I just gave you the answer. The cervical area, we want to treat C5, C6, but when there's any inflammation in the biceps tendon, communicates with the shoulder capsule. So we also want to treat the entire shoulder. So yes, the issue's here, but there's going to be inflammation in there. So what do you think with the heads? Can I stay with this one, or should I choose a deeper one? Because I'm going to come around now.
Might switch to a 10 because he's got more muscle.
Yeah, switch to a 10, absolutely. Where did I put that?
And it's behind you.
And normally we're cleaning between,
It's not cities there.
what?
By the end of the day, the pads are just.
Yeah, they're like everywhere. Like, where are they? I lost a pad.
I always think I've lost one, okay.
Leave him. So I want to come around the shoulder area, again thicker, so I'm going to hang out. I could also come up a little bit higher. Now maybe I'll come up to a 1. And again, I'm feeling him, what's going on here. He's pretty like, yeah, whatever. And working my way around. As you come in medially, just be careful, brachial plexus. Do you use these with your brachial plexus dogs? What do you think? This is like hard jumping out season, so we definitely see a lot of them, and we're treating coming into the brachial plexus, coming underneath. Also, definitely, we're having a little bit more success with them maybe than laser, but we try both. Some are going to make a difference. Medial shoulder instability, when you have those, so definitely treating the teres major, which is a thick muscle, so coming in and again moving around and coming in medially as well. One of the things we talked about in my group is not to overdo it. So we have a ton of dogs that have bilateral elbow dysplasia, hip dysplasia, and lots of other stuff going on. We will tend to just focus on the problem of the day, so to speak, because very often if you do too much, they're just exhausted. Doesn't give you a lot of time for other things to do. And if, again, we're following very few dogs, and most of them are at end of life. They have certain issues that we're just doing palliative care. So this is, where does this fit into your multimodal? But sometimes it's just too much. The same thing with laser. You just put too much energy in the body, and the dogs are exhausted after. The dogs should rest when they go home from rehab. Not go duck diving or whatever. And then I let it slip. But with biceps tendon, I always like to come up and treat the spinal segment. And just complete that whole path. So think about also cervical compensations. If the dog is lame on the left hind limb, or forelimb rather, when they strike, what happens? Head comes up. So you've got everything here compensating. So think about where we're starting from, think about the compensatory issues. So it's not just quick, hey, biceps tendon, got it, done. Same thing with the supraspinatus, tenosynovitis, issues with that. We want to get the whole region. With elbow dysplasia, so certainly bony elbow, what do you think about this pad? Should we 5 go down? Yep, depending upon the dog. And we want to treat the whole area. And again, just pick a spot, what works for you. Like in my head, I always like to start laterally, move cranially, move medially, come out. Being on the Electronon may not be very comfortable, so we can go a little bit distal, a little bit proximal. They're always tight in their triceps because they're compensating. They may not have that full range of motion in the carpus either, so we can come down and address there, but then also come up. Because again, they're striking, jerking up, and what does that shoulder do there? Does that all make sense? Questions or other conditions you see in the forelimbs?
What about treating feet for arthritis? Just use a smaller pad.
Yeah, so we were talking about that, so,
I'm sorry.
no, we were talking about it about bracing. Biscuits never had a foot injury.
Knocking wood.
But definitely like sesamoiditis, sometimes fractures that sit there. So just depending upon the size of the foot, going to the smaller pad and going over. Keeping in mind it's very superficial, so the lower the better. We don't want to crank this up to 10.
Just like people, right, our hands and feet are super innervated.
Yeah.
So they're super sensitive. And on a small dog, I'm not hesitant to put a zero pad on when I'm working in the metacarpal area. Because there's nothing there to
Yeah.
worry,
But you can be so impactful, especially your athletic dogs, your racing dogs. I mean, sesamoiditis will take a Schutzen dog out. I mean, that little inflammation, so can we calm that down right away? Those typically turn around in 1 or 2 visits. If you've hit it, you've got it. Carpal arthritis is huge. Again, think about those dogs, they're transferring so much of their weight onto the forelimbs, how sore is the carpal area. We see a lot of field labs that, by the age of 5, because of all the running they've been doing on that uneven surface, their carpal joints and metacarpals, they're so arthritic, they're so down. So treating them with this helps greatly with that area. Other questions about anything else you're thinking about with the elbow, shoulder?
What you did like for supraspinatus, you do that.
Yeah, so supraspinatus, the same thing, we're gonna get over the tendon. I like to follow it up to the supraspinous fossa, work there, and then come up and also treat the cervical area and then surround the shoulder. So anytime, and think about too, what the elbow involvement is. So it's rare that it's just the shoulder. A lot of times, especially with these medial shoulder instabilities, I'm finding just treating the elbow once or twice, and they may have an underlying condition sitting there, and that we're being okay with.
So one thing I want to mention from the contraindication side when we talk about PV, elbow dysplasia, puppies, growth plates, okay? So this is a talking point, something you guys have to play with. High energy will stop the long bone growth when you're at the growth plate. So in equine, we have a very good study with annular deficiency where we do it on purpose, right? And elbow dysplasia, yeah, you can kind of do that on purpose, but you need to understand what you're doing and the client know. If you're just trying to work with pain and a small amount of changing, low energy isn't going to be nearly as dramatic, and it's probably okay and not going to damage the growth plate or anything else. But you will hear that growth plates are a contraindication, and you don't want to use a ton. I had somebody just contact me about an 8-month-old cold with an OCD lesion that she wanted to treat. Now in the elbow. Now the issue was at that age and the amount of energy she needed for the OCD lesion, it was going to be difficult with the growing bones and the growth plate. Now if she just wanted to treat the joint and inflammation super low, I would have said I'm not concerned, it's something to be aware of. But to treat OCD lesions, you're looking at very high energy, or you're looking at 9 9 to 15 on our machine. And I had this, saying, well, that's gonna be a problem with your growth. So, again, it's understanding what you're physically doing to the tissue with how much energy you're putting in. That makes sense?
And think, with a lot of, for the most part, everyone seems to, I'm hearing, you'll turn the intensity down, treat lower. And, certainly, again, looking and you'll get the same benefit with most likely not that soreness. Do the dogs love coming in for shockwave? Like I look at Maverick, he's huge, and you can think about this like a horse, but less is fine with him. The initial intensity maybe to kind of turn it up. I look at the horse world too, and to me, like gentler, if you identify the lesion, I look at our horse's back is so sensitive, to anything. If I brought this anywhere near him and cranked it up, it'd kill me, just to give me the response. But we think bigger dogs need more and horses need more, but that's not the case. If you found the lesion, and like when we were with him, and we saw right when we were on the iliopsoas, he was letting us know. He wasn't biting, but he was definitely giving us stress signs and all of that sort of stuff. Treating the cervical area, so cervical IVDD or wobblers. How many of you are using this on them? So good area, there's most of the time the cervical area, the musculature is huge, and the amount of muscle tension that is in there, very often with cervical IVDD, you can make a big difference. And I'll usually start at C6, C7, and with a dog like Biscuit, I'm going to use the round head. I'm not going to use the linear because it may be too much. We don't want to put, again, thick muscles, but we don't want to put too much in there. And get you naked here. Now you're naked. Relaxed. I always put the dog in a position where they can move for me. So if they don't like what's going on, you can sit up. I'm paying attention to that. I don't want them restrained down if they're giving me a sign. So in treating the lower cervical area, again, I don't move around a lot. But in the cervical region, on most dogs, you have to take up some of the skin slack, so move it over so you can actually get underneath. But I may start left side, move right side, then come a little bit central, and move up. We want to be careful of not coming over the carotid arteries, but certainly there's a lot of musculature laterally that we can work on as well. Again, watching, is he okay, everything going on. Some dogs, you really have to know the dog, TMJ issues. This is wonderful to use on, and then working on the surrounding musculature. So suboccipital areas get very sore from compensating for TMJ issues. And that'll use a smaller head and not very much, maybe 200 to 300 total for the treatment, because it is a very sensitive area, even in a Rottweiler or a Pit Bull that has a jaw that can do anything. Yes, thank you. Something's going on here. I mentioned that with laryngeal paralysis, don't come on the laryngeal area, but the surrounding structures. So to get them back in a better posture and work with that. DM, what are you guys doing for your DM cases?
Lots of burgers.
Laser. Lots of laser, yeah. And definitely I was involved in a study. We looked at higher dosages of photobiomodulation. So adding or taking away laser and adding shockwave has been like another little boost to our protocol. We see a lot of DM cases just because they have DM, I was talking to a few vets the other night, we tend to forget that these are older dogs, they have arthritic joints, they should be medically managed also on NSAIDs and pain management. A lot of them are told, hey, your dog has DM, probably be dead in a few months, you know, and you can make such a difference. And we've had owners, we treat their dogs, their hips are sore, they have lumbosacral issues, you know, so we're addressing that, and they're more upright, they're feeling better. You know, these elbows, these shoulders, but also along that thoracic spine. And so bringing energy, you know, can we get more blood flow to the area? And that's essentially what we're looking at to help with the improvement. So it's, you know, try it. You know, a lot of our DM dogs are with us for a long, long time, and let's change it up. So we tend to look at every 3 treatments. Okay, this is not working, the dog's not feeling any better. But don't forget, those dogs have so many other issues going on too. And with the exception of probably one dog that only gets, you know, shockwave or laser for their treatment, we're doing some sort of exercise with them, whether it's core strength, if they can't make it in the underwater treadmill anymore, we're doing some other, you know, other things to help work on their, just their overall core strength, their respiratory strength, using snuffle mats and things like that. So, you know, kind of, you know, think like, oh, it's just DM, so that's it. But you can really make a big difference with them. And I'm surprised so many of the dogs are not on medication. They just, why not get them on joint support too? They're older. You know, they need all of this stuff.
I've seen a number of cases that have come to me to the DM diagnosis, and I've had them do the DNA testing, and they're not even carrier, right? So I have really approached a lot of those cases as though they're just an IBDD case,
Yeah.
because maybe that's what they really are. But I also agree with you, I've addressed the joints and things like that.
Yeah.
I've done things like have them stand over, if they're tall enough, over a peanut ball, so that I get them standing and supported, and then we'll do muscle stem on my quads, the hamstrings, cranial tibial, just to try and see if I can keep those things firing and keep a little bit of tone there. Electroacupuncture, so different things like that too.
Yeah, and definitely that's a good point with, you know, getting them into functional positions to treat and to also stretch. So a lot of times, like your lumbosacral dogs, if you have them draped over a peanut in an infinity, you're getting some positional traction. So that's feeling great. And if you shockwave at the same time, you're getting more of a benefit. So the dogs may not stay there for a super long period of time, but you get them up there, and for others just kind of melt because they're relaxing themselves. You know, it's a very relaxing position, it's unweighted, and we're getting some nice traction, you know, there with it also.